Hi, everyone. Welcome to the Self-Care Forum podcast. My name is Dr. Cedric Bajitu, your host for the hour. We bring knowledge to empower you and address the root cause of your disease. Our goal is to interest you in the care of the human frame, in diet, and in the cause and prevention of disease. Today, we're joined by none other than Dr. Kemmy Mokaya. Dr. Kemmy Mokaya joins us again following her first interview on the Self-Care Forum podcast. Dr. Kemmy is a highly respected, Ivy League educated, board certified dermatologist. She's skilled in medical, surgical, ethnic, cosmetic, and lifestyle dermatology, and has been practicing for over a decade. She's trusted by thousands for the exemplary, compassionate care that she provides. Dr. Kemmy is also a mindset coach, a best-selling author, and a podcaster. She is a dynamic speaker who empowers and inspires as she speaks about mindset, the skin, and other topics. Her mission is to help people adapt and sustain habits that create healthy minds and bodies so they can live to their fullest. Dr. Mokaya joins us to discuss her book, Live and Look Younger, a dermatologist's guide to youthful skin and ageless beauty. Dr. Kemmy, I want to thank you for joining us once more on the Self-Care Forum podcast. How are you?
I am doing great, and thank you so much for having me on this excellent podcast.
Yes. Thank you again for joining us and blessing us with your knowledge. Now, of course, last time you were here, we had a discussion which more so centered around your work, what inspired you to pursue medicine, and particularly the field of dermatology. But today, I want us to go a little deeper into your new book. Okay, so I want to start by asking, I know dermatology is a passion of yours, but what inspired you to put pen to paper and write this book?
So, writing the book, there are many things that led to the pathway to writing the book. And, one of the things is that in my routine office visit at the dermatologist, sometimes we manage specific diseases where it's all about disease management, but other times patients are doing well, or patients come for routine skin check where there are not so many specific problems. And then they have a chance to ask me a lot of general questions. And so I'd find that patients would ask the same questions over and over again. They'd ask me, how should they come up with the ideal skincare routine for themselves? How can they figure out what's good and what's bad? Because some of them would say that they spent thousands of dollars on this skincare line that worked for their sister, but it didn't work for them. So how can they know what will work for them? So they ask me a lot of those questions. Or some of them would say, I know that you offer Botox and fillers and all these cosmetic procedures, but I either don't feel like paying for them, or I want to take back the power myself and want to be able to empower myself to look younger without needing procedures. What can I do? So the book was an answer to their questions. I would compile the questions as they would ask them, and some questions became more common. And so, when they would ask the questions, I would tell myself, okay, I'll write a book someday, or I'll do a blog someday. I'm going to address these questions. It was always there. So one of the things that was triggering me was the patient's questions. But the thought of writing a book actually didn't really come to mind until a few years ago when I went to visit my mom, and she was doing some spring cleaning. And so on one day when we were supposed to go out to the zoo, it was raining and we really couldn't leave the house and there's nothing to do. So my mom said that she's going to take the kids, watch the kids, and she pinned me down and told me, go back to your old bedroom. I need you to sort out what you want me to keep and what you want me to give away, because we can't have things the way they are. So that day I didn't have any excuses. There was nothing to do. She was watching the kids. I had to go to the room and tidy up things. And when I was going through things, I came across a diary that I kept when I was 16. And around that time, Chicken Soup for the Soul was really popular. And I'd read Chicken Soup for the Soul. And one of the stories encouraged me to come up with a bucket list. And so it said, write down 100 things that you want to accomplish accomplish through life. And one of the things was to become an author multiple times. So when I read through that, there's some things that the time had passed. There's some things I wanted to do by 25 that I clearly didn't get done. But then I remember it saying that by 40, I should have written a book. And I was like, this is something that I think I can accomplish before I turn 40. So that gave me a little bit of extra impetus to write the book. And I'd say the final thing that gave me impetus was actually around the time when I was giving birth to my third child. And so I was over 35 when I was giving birth to my first child. And whenever mothers are over 35 and they get pregnant, they're called geriatric pregnancies. I don't know why they have that name, but they just happen to. And so, I'd given birth to my son, and it was in the morning when the nurses were doing their rounds, and it was a teaching hospital. So one more experienced nurse was training a younger nurse, and I could hear them outside the door, and she's like, oh yeah, here's another older mom. And then the young one who was clearly in her 20s, she's like, what's up with all these geriatric moms? Why can't they just have kids earlier? Anyways, them calling me geriatric, and then they were talking in outside, and one of them was like, oh, when they're old, they'll look like grandmas when they take their kids to college. And I knew, even though I knew it was a geriatric pregnancy, I really didn't think about it that way, that, oh my goodness, yes, if I don't take care of myself, I actually might look like a grandma when my child is graduating from college. And again, no offense to grandmas, and it's amazing being a grandma and living that long, but I don't want to be a mom who looks like a grandma. I don't want to, as a mother, be mistaken for my child's grandma. Again, there's nothing wrong with that. It's just that, again, most moms, you want to look like the mom you gave birth. You don't want to be mistaken for the grandma. So I think that one incident is the one that made me think, oh my goodness, I must do everything that I can to look younger, or just to look amazing, so that I can go toe to toe with other kids when we go to kindergarten. I want to look the same age as the 20-year-old mamas who are taking their kids. So I said, I want to learn everything I can about looking younger. And in the process of learning, I was like, let me just, I've always wanted to write a book. It's in the bucket list. I want to live and look younger. So I was like, let me write a book about living and looking younger, because it answers the questions my patients asked. It is something that's very relevant to me, and I'm sure also relevant to many other mothers and many other women who, for many reasons, whether it is career or not finding the right person, or many other personal reasons, women who find themselves giving birth in their mid and late 30s, and they're quote unquote geriatric pregnancies. So this book is for them and for pretty much everyone who wants to live and look younger. But that was when it became personal for me. That's what really gave me the push and gave me the incentive to write the book, even with a newborn baby. And when I was on maternity leave, I just took advantage of the time and wrote the book.
Wow. Well, and those are good reasons. I mean, better late than never, I always say. So let's talk a little bit about what you learned and what you were able to put together in this book. So let's talk about the skin and how it ages, right? You talk a little bit about, in the book, you talk a little bit about how some facts about the skin. It's the largest organ in the body. It accounts for about 15% of your total body weight. Now, tell us a little bit about how the skin ages. What are some things that contribute to this process, to this system?
So, as a dermatologist, before I did dermatology, I thought that skin aging was just inevitable, and it was something that was 100% genetic, and that how you age is influenced by your genes. But, in dermatology, we learned that there are two causes of aging: intrinsic causes and extrinsic causes of aging. So the intrinsic causes of aging are the causes that we really can't control. That's the clock that we can't stop. The clock is just ticking, and it's the way we're programmed. In our cells, the telomeres shorten. The telomeres are part of our genes. As they shorten, we're aging. So there's the intrinsic aging that we can't do anything about. That's just the natural progression of life. But then, as a dermatologist, in my dermatology training, and also especially more so as I was writing the book, because I did a lot of research and dove into this topic, there are what we call extrinsic causes of aging. And these are things from the environment. These are actually the things that we can control. So, so again, the intrinsic is the inevitable, and your genes kind of play a role. But then even more than that is extrinsic causes of aging, things outside us. And, for example, one of the leading causes of premature aging is ultraviolet radiation from the sun. It causes mutations to DNA damage, and causes oxidative stress. And so sun exposure really ages the skin. And that's why when a lot of people look at their skin, your skin looks a little bit older and more wrinkly in the parts like your face or your hands, parts that are exposed to a lot of sun, as opposed to places that are hidden. Like, that's why the saying, as smooth as a baby's bottom comes from. If you look at most people's, the skin on the bottom, doesn't look as aged. It looks more smooth and regular than sun exposed skin. And so in the book, I go over, there are many, many extrinsic causes of aging. And in the book, and in that section of the book, I really go over the different causes of aging, just to give people an idea of what else causes aging. Because when you know what causes aging, and when you know that there are things that are external that are influencing how quickly you age, you can control that and prevent premature aging.
Thank you for that, Dr. Kemmy. Now, you also include and mentioned something called a skin age test. I believe it's called the pinch test. Now, what's the purpose of that test?
So the book actually has 3 different skin age tests for the readers, and they're quick ones like the pinch test, just to give you a quick and easy idea how quickly your skin is aging. So there'll be 3 tests to take. The pinch one is the fastest one, and then there's another short quiz, and then the book has a comprehensive quiz that's also on my website, www.drkemmymd.com. And the longer quiz pretty much asks you several questions about your skin. It addresses genetic factors, environmental factors, but when you answer those questions, you can learn how quickly you're aging. And I think it's a good way to gauge where you are. So for example, if you're 50 years old, but then you do the skin age test and it tells you you're 60, then you know you have a lot of work to do, because even though your skin might look a little bit more amazing then, it means that later on in life, you're gonna age very poorly and have a lot of the problems that come with aging skin, like being very fragile and bruising easily, having a lot of discolorations and wrinkles, having a lot of growth. So I feel like the skin age test is a good one to gauge how well you're doing. When I did it myself, I was embarrassed that my skin age wasn't where I wanted it to be, and that rapidly got me changing certain things in my life. So I think it's just a good reality check. It allows you to know where you are, and it just gives you more incentive to change things, to change your extrinsic aging factors so that you're not accelerating your pace of aging.
Now, here's something interesting, Doctor. Both men and women, when we go shopping, we're often looking for the best products. And now you hear more and more about choosing things based on your skin type. Whereas before, I was under the impression that you just kind of went and you got, a cleanser or a moisturizer. It didn't really matter. You got whatever fit your budget. But now there's all of this, targeted skin specific products. So how do you tell, or how do you determine what your skin type is?
Oh, that's a great question. And actually, there's another chapter in the book all about skin type, and it kind of goes into the different types of typing skin. The skin type method that we're most commonly familiar with kind of classifies skin as oily, dry, combination, or sensitive. And that one was developed in the 1900s. It was actually developed by a French marketer who came up with a cosmetic line. And it's what is used right now, the most commonly used way of knowing your skin type. However, it wasn't fully based on science. And so as I was doing research for the book, I came across this skin typing system, the skin type solutions typing system, which instead of just having 4 or 5 skin types, it has 16 skin types. And, it factors in a lot of things. For example, it factors in, the moisture content, whether you're having pigmentary issues or not, how sensitive specifically type your skin, then it's easy to know what product you should use, because you'll just know this is my skin type, and this product, as amazing as it is for person with a type maybe 1 skin, I'm type 7, it's not for me. So when you're able to more specifically know your skin type, then you can tailor your skincare regimens to your skin type. And so in my book, I just had information on all this. I have information on all the skin types. And I also even have a link on my website again on where somebody can go do a quick quiz and know your very specific skin type. So that way you're buying products that work for you and not just random products based on what somebody else says or how attractive the bottle looks like.
Well said. Now let's talk products.
Okay.
Products for a particular skincare regimen. You've got cleansers, moisturizers, sunscreens, all these different products. What are they for? For example, cleansers. What are cleansers used for?
So cleansers are used to get rid of the impurities on our skin. Every single day when we're outside, we're getting exposed to dirt, to, our bodies are producing oil and then the toxins in the environment. So we use the cleansers to just get rid of all of those from the skin and have a nice clean canvas. And I actually recommend that people cleanse their face their face twice a day, and their bodies, they have a shower at least once a day, cleanse your face twice a day, because in the evening you're cleansing away all the impurities that accumulated during the daytime, and you're giving your skin, you're just helping your skin get rid of everything and not be stressed out, because when we go to sleep at night, that's the regenerative phase. So you don't want your skin to be stressed out dealing with the pollutants and everything it gathered during the day when it's supposed to be repairing itself. And then at night, in the morning, we also recommend cleansing your face, because at night you are making oil, and as you slept on the pillow, you are also drooling, which has bacteria. So you still have some of the oils and the dead skin and other stuff on your pillow that's on your face. So you'll also want to wash it in the morning and have a fresh start before you face the day. So that's what cleansers are for. They're for removing impurities from the skin. And while a lot of people just use regular soap and water, if you're younger, in your teenage years or your early 20s, sometimes that's enough. But as you get older and your skin is getting a little bit drier and the oils are changing, you will want to use a more specific cleanser that's the appropriate pH and that's more appropriate for your specific skin type.
Thank you for that. What about moisturizers? And when should we use them?
So moisturizers, I think, should be used also at least once a day. And even people with oily skin, a lot of when people have dry skin, their dry skin types, it's very obvious that they need moisturizers, because when they don't have them, the skin is dry and uncomfortable. And a lot of people with oily skin think that because their skin is already oily, they don't need a moisturizer. But actually, even when you have oily skin, there's some moisturizers that kind of fill in the gaps. The oily skin, yes, will do a lot of the moisturizing for you. But then a lot of moisturizers, especially those designed for oily skins, they're kind of filling the gaps, and they have other things that maybe you don't have enough of when you have oily skin, and they tend to restore the natural balance. And so, even for people with oily skin, if you wash your face the right way and get rid of the excessive oils, and then use the right moisturizer for yourself, you're able to get the balance of the oils in your skin in the perfect way, that you're well moisturized, and the skin can do its job, its barrier function of keeping out dirt and retaining the moisture inside.
Okay. Now, here's something that I'm really interested in. I've always wondered about this. On a hot day such as today, you see a lot of people going out with sunscreen on. Mm-hmm. And for people who are more melanated, people with darker skin or blacker skin, the old saying is that we don't really need sunscreen, because the melanin itself protects us from the harmful effects of too much sun. Now, in your opinion, do we need sunscreen? Or rather, let me rephrase that. Who needs sunscreen?
So the official The official answer, from the American Academy of Dermatology and the way we're taught as dermatologists is that every single person needs sunscreen. So whenever you have dark skin, the really nice, rich dark skin, you have an SPF of about 15. But really, we like to say SPF 30 and high is a recommendation. So even when you're relying on your own melanin, you still need a little bit more help from sunscreen. However, for people, so if you don't have, if you have paler skin with less melanin, it's absolutely crucial to apply sunscreen every single day, apply it on all exposed areas, and to reapply, if you're going to be indoors, reapply it at least twice during the day. If you're outside, reapply every 2 hours. For people who have a little bit more melanin, your melanin is helping you. So maybe you don't have to apply sunscreen as frequently and as diligently, but the melanin is not enough. And especially if you're going to be outside for an extended period of time when the UV radiation is too much, sometimes the UV radiation is just too much for your melanin to overcome, and you start getting those mutations to your DNA and start getting sun damage. So even when you have melanated skin, sunscreen is recommended. And so, say somebody with my skin tone, I put sunscreen on every single day, just on my face. To be honest, I don't put it on my arms or my legs because I let the melanin take care of me there. Somebody with less melanin than me, I want every single exposed body surface to be covered. But really, I know that my risks, whenever you have a lot of melanin, your risk of skin cancers, they're still there, but they're a little bit lower. So, sunscreen, yes, protects you from skin cancer, but it also protects you from premature aging, and it also protects you from sun damage and the discoloration on the skin and the change in the complexion that you get when you have unprotected sun exposure. And so for people with less melanin, sunscreen is more crucial because it's not just it's not just a vanity thing for I want to age more slowly and I want to have more clear skin. When you have less melanin, you're getting more mutations to your DNA and you have a higher chance for skin cancer. Whereas for a more melanated person, maybe that skin cancer will come when you're 100 or 110, but the sunscreen will also help you prevent some things that give people a lot of anxiety, like discoloration and unnecessary wrinkles. So I don't know if that clarified things a little bit.
It does.
It does. So again, sunscreen is recommended for everyone, but initially sunscreen was created to protect against skin cancer, and people with less melanin have a much, much, much higher likelihood of getting skin cancer. So for people with dark skin, black skin people, especially the darker ones, your skin cancer risk from cancers like basal cell carcinoma, squamous cell carcinoma, that's extremely low. So you're using sunscreen more for other things. That being said, we've seen all types of skin cancers in people of all skin tones. So while they are rare, I've seen skin cancers in people of all skin tones. So your risk is still there. And so that's why we recommend the sunscreen, because the risk is still there.
Wow. Now, you also talk a little bit about skin treatments. Can you elaborate on that a bit, please?
Yeah. So, if you want to have a really basic skincare regimen, you'll just have your cleanser, your moisturizer, and your sunscreen. That's as basic as it gets. Like in the morning, you cleanse, you moisturize, you sunscreen, and then in the evening, you cleanse and moisturize and go to sleep. However, there are things that treat the skin and help the skin out, and that's what I classified under as my skin treatments. These are things that just address specific problems. And so under skin treatments, I talked about, there's a segment on retinoids, which are vitamin A-like compounds. Retinoids are some of the most studied topical compounds by dermatologists because they do so much. They're used to treat acne. They're also used to help people with pigmentary issues. They help even out the pigmentation. They're also shown to stimulate collagen production, so they reduce the fine lines and wrinkles, and they also speed up the cell turnover cycle. So as we know, our skin turns over every 30 days or so, and a quick fact, a lot of the dust in our homes is actually dead skin because it just sheds off and we don't really see it. So our skin turns over, but as we grow older, the rate of cellular turnover is slower. So a child will have a much faster turnover cycle than an adult, a middle-aged adult. And so what the retinoids help with is that they help speed up that turnover cycle so that the dead skin cells that are looking dull and older that have accumulated on the surface of skin can be removed, and nice younger looking skin can be revealed. And so retinoids are one of the skin treatments that do so much, and that's why there's a segment on them. They really help the skin, but they are treatments and they can irritate the skin if they're used in the wrong way. So there is an art to using them properly so that you can get the results without the side effects like dryness and redness and a rash and peeling and sensitivity. And the book, actually, it's a bit too much. You could actually have a whole podcast episode just on retinoids, so you'd have to just read the book to get more information, but they're one of the most popular skin treatments, and one of the treatments I recommend for people age 30 and above who just want to, stimulate collagen and kind of delay the signs of aging.
Wow. Now, what?
And then the other segment on skin treatments, there are also other treatments like antioxidants that our skin needs. Even though we can get antioxidants from our food, it's sometimes when you apply it on the skin, it gets there so much faster, so much more with more potency. And so there are many amazing ones. There's a big segment on vitamin C because again, it's also a very well-studied antioxidant that really, really helps out the skin. Collagen produced, evening out pigment, and there's information on all that in the book. So I definitely recommend adding skincare products with antioxidants, and usually you can do that step right after the cleanser before putting the moisturizer, or you can get a moisturizer that actually has those skin treatments infused, or you could use a serum just after the washing, after cleansing your skin, so you cleanse and then use the serum or other product with the skin treatment, and then your moisturizer and your sunscreen. So many steps, and there are many regimens. And again, for men like to be minimalistic. So I'd say for a man, I would try to combine a lot of things together so that it's many products, but just 2 steps. And then for women, there's so many steps out there. There's this K-beauty trend where people have a 10-step or a 12-step beauty regimen. And some people really like that. They just feel like it's part of their self-care routine and they love to go through all the steps. They just feel so good and so proud of themselves for taking care of their skin so well and going through so many steps. I respect that. I tend to be more of a minimalist. So I think we should still try and incorporate all those things, but I like a more minimalistic approach where you're still getting the important thing, but not having as many steps. Because as a busy mom, and I know that life is busy, sometimes you just want the bare minimum to get it done and move on. And so in the book, there's something for everyone. There's information for people who want to follow the long 12-step routines and have that satisfaction and having good self-care. And there's also information for people who just want to be quick and efficient and move on.
Well said. Thank you for that. Now, you mentioned food, so I want to transition into the strategies to counter aging. I believe it's called the fresher lifestyle strategies to counter aging. And the first topic, or rather F, stands for food. Can you elaborate a little bit on that?
Absolutely. So nutrition actually plays a really, really big part in aging, more than we think it does. And so there are certain foods that we eat that can accelerate the aging process, either because they increase inflammation in our bodies. And when our bodies are inflamed, it just exhausts the system and accelerates aging. So some of the foods that you eat, especially, for example, processed foods, they're just more pro-inflammatory and they'll make you age faster. And then on the flip side, there are also certain foods that when you eat them, they're full of antioxidants and just they're life-giving, full of life, and they'll slow down the aging process. And the one example, so again, that section goes into food a lot, but the one example, the one striking time when before I'd even done the research, when I saw the impact that food has on how you look, is there was this example of this couple from Florida who had been married for several decades. They were both in their 70s, but the wife looked like she was in her early 40s and the husband looked his age. And so when I think it was on CBS News, when they went to investigate why, they found out that the wife was growing a lot of her foods in her compounds. They were all organic, lots of vegetables, and she was having a very plant-based heavy diet. Her diet also tended to be raw or slightly cooked, but she was pretty much eating eating food in the right way, in a way that was just life-giving and energy-giving and youthfulness preserving. And then on the flip side, her husband just had the nice standard American diet where he would have dessert when it was offered to him, burgers, pizzas, lots of meat. And so he just looked his standard age, was a little overweight, had diabetes and all the problems that you kind of expect to see in the average 70-year-old. And then in the meantime, had this amazing looking wife who looked like she could be his daughter, and they were similar in age. So that's when I learned about that several years ago, it clued me into the role of diet and aging. And diet really does play a big role in the way not only the skin but also your entire body ages.
Yes. And not only diet, but I believe rest as well. You talk about that. Am I right?
Absolutely. So rest is really important, getting adequate sleep. As I had mentioned earlier, when we go to sleep, our body regenerates itself. That's the time for our body to repair itself. And, there are optimal amounts of sleep we should get. So of course, we know that we should get 7 to 8 hours of sleep, but it's not just quantity, it's also quality. We have to make sure we're getting quality sleep and creating the right environments to sleep so that we can have the full restorative sleep. And so, it's a work in progress. The book has a lot of tips on how to create the right sleep environment, how to just how to modify a few lifestyle things so that your sleep is as restorative as it could be. And there's always room for improvement. You'll read the chapter and you'll find that there's some things, most people will read and find that some things they're doing right and some things they're not doing right, but it's all gradual step-by-step improvement. And, I like to read that chapter often because a lot of times I break a lot of the rules that I give people, or the suggestions that I give people. It's just very easy to do that sometimes. So you have to constantly remind yourself. But if you want to look good, beauty sleep is a real thing. And if you want to look younger and live younger, you really, really must get quality sleep.
Now, I also think, I also want to highlight the impact that stress plays on health, right? There's positive stress, and then there's negative stress, which is often chronic stress that just doesn't seem to go away. How does that play a role? How does stress play a role in in anti-aging?
So stress, as we've alluded, acute stress that's short-lived is actually good, and the bodies were designed to handle short bursts of stress. However, in the life that we live in our modern society, we have a lot of chronic stress, and unfortunately our bodies weren't designed to handle chronic stress. Whenever we have chronic stress, there are many things that get out of whack. Our hormones actually change. The stress hormone cortisol is raised, and a few other hormones get out of whack. And in addition to affecting many other body organs like our brain, our cardiovascular system, stress also affects the skin, and the more stressed we are, the faster we will age. It also affects the hair. A lot of we had known for a while that stress causes our hairs to gray, but there was no scientific research that proved it. Up until about 3 years ago, I believe there was a study that was done at NYU where they monitored people and monitored how stressed they were. And it was really interesting how when somebody had like a stressful episode of their lives, for some of the people, their hair is actually turned gray during the stressful periods. The melanocytes that give hair color actually stopped producing melanin. And then when the stress resolved, some of those gray hairs got back to their normal color. So hair is one thing that is affected by stress, and a lot of chronic stress can make us gray prematurely. And of course, we associate gray hair with aging faster, but it's not just the hair, it's also the skin and many other parts of the body where the more stressed we are, there's a lot of inflammation and we're aging our bodies, and just the stress is taking a toll on our whole bodies, from the skin all the way down to the internal organs and also our minds. So stress control is one of the most important things that people should focus on if you want to live and look younger, not just for vanity, but also for your general health.
So there's hope for me and my graying hair then.
Actually, actually there is. After I read about that study, I was like, that's interesting. And actually, I experienced it myself and I thought I was just imagining things. But when I was in my 20s and I'd have exams coming or some really stressful periods, I would notice some gray strands in my hair, and they're kind of a silverish kind of gray, sometimes had a streak of gold. And when the stressful episode was gone, if I plucked the hairs, there would be different colors on that strand. It would be black on some parts, gray on some parts, black on some parts. And I thought I was a little bit weird, but when that study came out, I was like, okay, that's just my body showing me that I had those periods of stress that I needed to control. And it was the body's way of showing that we should handle it and control it.
That's right. There's hope for all of us then.
There's hope for all of us.
So let's talk about the environments that we find ourselves in, right? And I think this ties a little bit more along with stress that you mentioned. But you talk about the environment playing a role in your skin's ability to look younger. Can you elaborate? Are you alluding to maybe if you live in a polluted area, or what exactly do you mean by the environment?
Yeah, so for the environment, I actually broke it down into two things because we have two environments that we're exposed to. There's the external environment, where we just are in the world outside, the air that we breathe, the toxins that we get into contact with. But then there's also the internal environment. So, right now people are talking about the microbiome. That's the bacteria that live on and inside us. So the microbiome, we have billions of bacteria living in our gut, and that's kind of the internal environment that they are in, as well as some living on our skin. But pretty much that part of the book will talk about the external environment and how to protect ourselves from pollution and from things on the externally, but it also really zooms in on the microbiome and how we should preserve our microbiome, because taking care of the bacteria that live inside us, the things inside our inner environment, will not only affect our skin, but it affects our gut and our gut patterns, and it even to the skin. It also has implications to our overall health and well-being. Just caring for the microbiome.
Mm-hmm. Thank you for elaborating on that. Thank you so much for elaborating.
I didn't want to go into so much more detail because I want people to read the book, but it really will go into how to care for your microbiome. And it even goes into, what kind of probiotics you should get, prebiotics, probiotics, and which ones are particularly good for the skin and for reducing premature aging.
So in this day and age, people are always looking for a shortcut, a quick way to get to the end result, if you will. And for a lot of us who want to look younger, it goes by way of things like Botox, right? Cosmetic procedures. So how do you choose, an optimal cosmetic procedure? What are some things that people should think about before choosing a cosmetic procedure?
So that's a great question that you've asked. And that's why there's a whole segment in the book on how to choose optimal cosmetic procedures for you. There are so many out there, and increasingly more and more have been put in the market. And, there are ways that you can be a savvy consumer versus a vulnerable consumer. So, I'll kind of answer that question in the reverse. There are ways not to choose a cosmetic procedure. And the way not to choose one is to blindly follow. So say, for example, if your sister got Botox or fillers and she was really happy with it, or your best friend, and they're like, oh yeah, go to so and so, she does an amazing job, go do that. Just doing it based on other people's suggestions is the way not to do it. The way to do it is to, you first of all need to figure out what it is that you really, you have to figure out your preferences, your health conditions. There are many things. It's such a complex question to answer, and that's why there's a whole segment on it. But pretty much, first of all, I'll just start out by saying there's nothing wrong in getting these cosmetic procedures. There's nothing wrong in getting Botox or fillers. I grew up in a very conservative Christian environment, and growing up, partly part of growing up, I was led to feel that if you did anything to change your skin, whether it was injecting things or doing things, it was wrong. Now that I practice dermatology and I inject Botox and fillers, I know exactly how these procedures are done and what goes into it. And I I personally don't think there's anything sinful in doing them. They can enhance the way you look. They can improve your self-esteem. And when you have a higher self-esteem, there's so many things that you can accomplish in life. Or so much, you can go so much further just when you have more confidence and happiness in yourself. So for all of those Christians out there who think it might be sinful or wrong, or it's showing God that you don't appreciate what he gave you, I don't think so. I think there are cosmetic procedures that you can do that are very minimally invasive, where you're not going under the knife and you're not changing too much. You're just enhancing what God gave you and looking fresher, looking younger. So there are just many out there, but when you choose your procedure, obviously you'll want to factor in your personal preferences, how comfortable you are with things that are either minimally invasive or a lot more invasive. You'll want to factor in your budget and how much you want to spend. And so there are many things to go into. And one way not to do it is just by going with the flow and either letting a friend influence you or letting somebody who offers the cosmetic treatments influence you just because they want to sell a product. So remember, even though they're out there to help you, some people are just in it to just make a quick sale, and you want to make sure you're true to yourself and be very clear with what you're trying to achieve so that you can choose the right things for yourself.
Well said. Well, I want to talk a little bit about one of the more popular options available out there. It's a neurotoxin called Botox. We hear about this all the time. This celebrity got Botox. This person got Botox. What exactly is Botox, and what does it do to our skin?
So Botox is a neurotoxin. It's the most common one, but there are many others available like Dysport and Xeomin. But pretty much Botox, it's a toxin that's injected to relax the muscle. So, our skin has three layers. We have the epidermis on top, the dermis, that's the middle layer. There's a layer of fat. And then underneath that, there's the fascia and the muscles. And muscles, when you use them with time, they get bigger. So a lot of times, because of constant smiling and frowning, our muscles get bigger and thicker with time. And so as we're getting older, we have our muscles getting bigger and thicker, and we have our skin getting thinner and thinner. And so the result of that is a lot of wrinkles that are prominent because of the muscles underneath getting bigger and thicker and the skin getting thinner. And so the Botox kind of temporarily paralyzes those muscles. So for example, the muscles of frowning, there's some people who, because of frowning so much, they'll have 11 lines on the glabella. And so when you inject the Botox into those 11 lines, the muscles don't move anymore. And because they just kind of don't move and flatten out, the wrinkles are less prominent. And so when it comes to treatments like Botox, the most common areas that they're used for are the 11 lines on the glabella, also the horizontal forehead lines. And then when people smile, they have crow's feet on the sides of the eyes. And so you'll use Botox for that. I'm breastfeeding, so I haven't done any of those treatments. I probably have another 5 or 10 years before I really need them. But they're treatments that when I need them, I will not hesitate to use them, because they just help you look younger. And for some people, they help you look less angry, especially people who've overused those muscles and they have a resting angry face. If you can relax those muscles of facial expression, sometimes people look more warm and more approachable and definitely younger. And so that's why Botox and neurotoxins are some of the most frequently used cosmetic procedures. And another reason why people love Botox is because, and similar neurotoxins, is because the Botox effect does not last forever. The neurotoxins last for about 3 months and then their effect wears out. So if somebody got Botox and they just really didn't like not being able to express themselves, in 3 months they'll be back to square one and they don't have to do it again. Or if they love the way they looked, then they can go back for repeated treatments.
Okay, now let's put it all together. You talk about the Ageless Beauty Plan, which consists of supplements, a 6-week plan, as well as a 6-week plan. So what sort of supplements should we take to help us in a youthful skin journey?
But just to make people buy the book, I won't go into every single supplement out there. I'll just talk about some of the most important supplements. So one of them is vitamin C. Vitamin C is a crucial vitamin in the formation of collagen. And if you have the right diet, you probably don't need to supplement with vitamin C. But if your diet is the standard American diet, or if sometimes sometimes there are just days when we don't eat our best, then that's one of the supplements that people can take. Another big one that's in the book is vitamin D. And vitamin D, especially in people, vitamin D insufficiency is a big problem in North America, especially in people with darker skin, because vitamin D is one of the vitamins that's synthesized by the sun. But because people in the northern hemispheres, especially in the wintertime, aren't out in the sun long enough for the skin to synthesize vitamin D, the vitamin D levels get low, and they can cause a lot of systemic body problems, as well as cause the skin to, when you have low vitamin D, your skin will age faster and your hair will actually be thinner and less healthy. So vitamin D is also one of those supplements that you should add to your diet for just skin and overall your overall well-being. And then for the rest of them, I'll refer people to the book.
Great point. Thank you again for sharing all of that. And as far as the 6-week plan to live and look younger, how do you disseminate that plan? Is this something that you work with people on a one-on-one basis, or is this something people can do for themselves at home?
Actually, something that people can do for themselves, because I really wanted to empower the readers to be able to just implement everything that they'd read. So the plan puts everything together. And in 6 weeks, if you try to follow the plan there, you will for sure see a difference in your skin health. And what a lot of people have done the skin age test before they did the 6-week plan, and then after. Some of my early readers who read the book before it was released, and some of them who actually followed the 6-week plan sent some before after pictures to me, and there's actually a difference in the way they are looking. So I highly encourage the reader to go through the book and read the book whichever way you want to read it. It has 5 sections, and then the 6-week plan, I definitely challenge you. It's in small bite-sized doable steps that you can just make in your life to have better skin, younger skin, and just be young, feel more vibrant overall if you follow the plan.
Thank you so much, Dr. Kemmy, for coming on our podcast and sharing all of this. And for those who are listening, the name of the book, once again, Live and Look Younger, a Dermatologist's Guide to Youthful Skin and Ageless Beauty. Now, where can we find this book? I know you sell it on your website, correct?
Yeah, so if you go to www.drkemmymd.com, you can get it from the shop section. Or if you don't want to have to go through my website, you could go to www.drkemmybook.com. And if you buy the book from drkemmybook.com, you'll actually get a more personalized book that's autographed for you, and just access to a few other places that people don't get on Amazon. But of course, there's always Amazon, and it's available on Amazon either as a physical copy, or if you're a Kindle reader, it's available on Amazon Kindle. So I'd say for now, you either get it on Amazon, physical copy, or the e-copy. Get it directly from me by going to my website, www.drkemmymd.com, and that's Kemmy, KEMMY.com. So www.drkemmymd.com. And I'm sure we'll share all this for you so that you don't have to type it down or feel like you need to stop and pause this as you're listening to the episode.
Yes, and when we post this video interview, all of those links will be included in the description. So all you simply have to do is scroll down to the bottom a little bit, and you'll find all of the links here to mentioned. So for those of you who've ever wondered how to get glowing skin, or what can you do to look younger, or how do you pick the best products and procedures for your skin, if you've ever had any of these questions, then this book is definitely for you. It was carefully written to answer all of these questions. And as Dr. Kemmy said, these are questions that she's been asked by her patients and clients over the years that she finally took the time to compile an answer to. So it was carefully written for you to teach you how to put your best face forward and have a healthy, luminous skin. And so everyone, I want to thank you all for joining us today on the Self-Care Forum podcast. We're now going to transition to the Q&A. So this is a part where we stop recording. Once
Well,
again,
thank you so much for this opportunity, and for the readers. I really hope you're inspired to at least grab up the book and check it out and to look better, because, we all want to look better. It's not about, again, the one other thing I wanted to clarify real quickly is that this book isn't a book that's on ageism. So we know that popular media and society makes us think that growing old is a bad thing and makes us dread aging. This book is not about ageism. It's about looking radiant and looking your best at every single age. So I just wanted to clarify that, because I remember when I gave the topic to an older friend of mine, she's in her 80s, she was like, oh, I'm not going to buy your book. There won't be anything for me, and I'm already old and wrinkly already. What is there for me? And I just told her, you can, there's still something in the book for you. And it's all about aging gracefully. It's not about anti-aging and, trying to do facelifts and forcing yourself to look 30 when you're 80. It's about looking radiant and looking your best at any age. And that's why this stuff on lifestyle, things that you can do on your own, that, it's about empowering you to really look your best, whichever way you want to do it, whether it's just based on the lifestyle changes you want to make, or based on products you want to use, or if you want to do cosmetic procedures, again, nothing wrong with that. So it's meant to empower and help people out in all spectrums and with all preferences. And again, it's, even though it says look younger, it's not to say that younger people are superior. I think all ages are perfect, and we should embrace our ages and look our best for whatever age we are. So I just wanted to clarify that, because I got a little bit of backlash from older people saying, well, this book makes us feel bad. And it shouldn't. I think you want to look your best at any age that you are.
very well said. And I think, Dr. Kemmy, fundamentally speaking, we all want to live and look younger. And so I think having a dermatologist put together something to help us get youthful skin and ageless beauty, it's a godsend. And so everyone, you're more than encouraged to get this book and follow the protocols put forth in it. Now, we're going to go into the part of the podcast where we answer questions, where Dr. Kemmy will answer your questions. So we're going to stop recording right now.
Perfect.
Listen to the audio version of the Self-Care Forum podcast on Spotify, Apple, and Google Podcasts.